All right, I'd like to thank you all for coming here today. I hope it's going to be very educational. My name's Jessica. I've worked with the library here in Covington for 20 years. The main reason I decided to put together this panel for here, bear with me, February 24th of 2017, at about 11 in the morning, I received a call from my mom, and my younger brother, Charlie, had died of a heroin overdose. I had seen many patrons coming in the library. You've seen people going downhill from it. There have been overdoses. We know of overdoses on the street, parents dying, leaving their kids behind. And it wasn't until my 14-year-old niece asked me, why did this happen? My brother's little girl. And I sat there and could not say anything. I'd always considered myself a very intelligent woman, but here I was unable to answer this question. And I think that's really the whole reason the library's always been here, for knowledge and community. And never do we need those things right now more with the heroin crisis going on. The panel today is very distinguished.
So I am a member of the Northern Kentucky community. In about 2012, in a small office in Fort Mitchell, I started noticing notices coming in. People wanted little briefs in the newspaper. When it was, yes, we were online, but print was the biggest deal still at that time. They wanted us to write little notices that they were having vigils for people who had died from heroin overdose. And at that time, I thought, this is very strange. You know, I started noticing the numbers growing, and I thought, general assignment reporters get assignments about anything, but largely we find our own stories. You know, we just are kind of out there. So I decided to make a call to St. Elizabeth and ask if there was a physician or somebody who was also noticing this, and was introduced to Dr. Jeremy Engel, who has been a face of, you know, the front lines of the heroin epidemic, trying to help people. He told me that he had seen 17 patients one day, and he was the on-call for night, and I think it was, he would probably correct me, but at least a third of those patients were somehow connected to heroin, whether it was someone who was addicted or someone whose family member was addicted, someone who was, you know, had been brought in for an overdose. He said they were treating it like bronchitis. Like the ER person would call him, hey, Dr. Engel, blah, blah, what should I do? This happened. And he said, I just can't have that. So that's when I knew I need to really, really dig as deep as I can and really hold on to this part of what I'm going to cover.
Again, my name's Amanda Peters, and I'm with the Heroin Impact Response Task Force, and I'm the coordinator. So I'm tasked with working as a community and government liaison to coordinate and the response between the different systems and players that are in this arena. And I'll just touch a little bit on what some of these folks here, because I know we have the Health Department, Northern Kentucky Drug Strike Force, and Northern Kentucky Hates Heroin here, so we will let them talk about what they're doing. So this task force was formed in 2012. I've only began this work close to a year. My background is social services, workforce development, and community organizing. So where I was not directly into the response work, I was dabbling in it in different arenas. Because what we've learned is that this epidemic touches everything. There's not been a person or an organization or system that this hasn't touched, or I haven't met them yet. So this task force brings together stakeholders from law enforcement, schools, workforce development, reentry teams, social services. Of course, our advocacy and grassroots is very important, but as well as government entities and policymaking avenues. And what we do is we look at a regional approach. So I coordinate the task force for 8 northern Kentucky counties, and that's all the way from Campbell to Carroll. But I'm also working with folks across the river. And this shows Hamilton County, but I coordinate with people all the way up to Highland County and even Claremont County, because we know the folks in Claremont County where they're getting their drugs in Ohio. And by the way, they travel from the 471 loop, is they're ending up in our Newport jails. This is a much bigger problem than just cities or organizations. So I talk to people in Hamilton, and then we're also starting to reach out to people in Indiana.
How do you feel, or is there like a plan to where they don't have to pay for the methadone, or where they, because my other thing is, I used to know somebody who used to abuse their methadone and sell it. So I had called on them once, and they knew I did it. I was very, yes, I did. I'm not going to lie to you. I mean, I'm a very honest person, and they did not like that I did that. So they had to, take it there, I think, for a little while. They did not like that I made them do that. But my thing is, you're getting help, and you're abusing that. Someone else who's doing the right thing, you're abusing the whole thing. Right. So you're going to screw it up for everybody else who's doing the right thing. And I feel that, what would you do? And what's the whole plan for those circumstances, the paying and the abusing of the methadone? I mean,
I'm not a medical professional. I have to say that. Yes,
exactly.
I always have to say that. I dabble in a lot of these worlds just enough to get me in trouble.
Right.
But methadone is very complex. It is a medicine, and lots of medications are abused. So that's going to happen. And we do have, I had my own feelings about methadone, so I went down there and spent a whole day there. I saw moms singing to their children. It was very lighthearted. There was counseling going on. It totally changed my view. And if anybody wants to do that, they're open and give tours. Is it perfect? No. People are going to abuse it. But with medication-assisted treatment, you need the treatment part. If we're just handing out methadone and they're not getting the therapy or the IOP or the treatment they need, it's not going to be effective. It might work for some, but it's not going to work for all. But there are different agencies that will help for pregnant moms. For 1,500 people a day, there's just not enough resources. Right. So getting those folks, some folks are going to be on methadone the rest of their life. Some of them are going to be a year or two. And some people are never going to go back to being the way they were before they used drugs. Their brain has been hijacked. Opiates take away your joy receptors. They're never going to go back to being that. And evidence tells us that they need a whole year of treatment, and that second year to really come out of the fog. This is a long process, and for someone who's dealt with a lot, it takes on a lot. So I'm not sure I can really answer your question, but we are looking at that. We are trying to get the people how to do that. And Kentucky is one of the most regulated states on within methadone, and Medicaid won't pay for it. Yep.
We thank everyone for honoring our work to try to make a difference. I am often asked, how do you do this? Have you taken time to grieve? Maybe you need to take a break. Is it good for you to think about heroin and addiction all the time? The answers to these questions are easy for me. Our son, lived this for half of his short life. Nicholas didn't use heroin for that long, but long enough for it to take his life. He started using marijuana around the age of 15, and this started the path of years of drug use. Nicholas made a choice to use heroin the first time. After that, heroin made choices for him, choices that changed his life like no other drug ever had. Soon after the death of Nicholas, our family hit the pavement running to make a difference in the lives of those suffering from this disease of addiction, and running to help the families like ours that were lost, ashamed, and terrified, helpless, and emotionally broken.
We're not in the middle of an HIV outbreak by any means. Our numbers are still low, especially compared with other parts of the country. But in 2016, we had 25 HIV cases. Only 5 of those were due to injection drug use as a risk factor. Typically, we see more sexual behaviors that are contributing to our HIV cases. However, in 2017, as of that should be March 29, 2018, we're still getting the numbers in. We had 45 cases of HIV, and 21 of those cases were due to injection drug use as a risk factor. Most of those cases have been in Kenton and Campbell counties, Covington and Newport. And that's our biggest concern, is that it's not an outbreak, but we are seeing a shift in risk factors, which means we need to respond differently when it comes to getting people into treatment.